Imagine waking up one morning and the world looks dimmer. The faces of your loved ones blur, the pages of your favorite book seem unreadable, and the sunset fades into shadows. For millions over 60, this isn't just imagination, it's reality. But science reveals something powerful to prevent this. Not another pill, but something far simpler: movement. Daily movement, backed by peer-reviewed research. And it's not what you think. Hang on till the end, because I've got some fascinating tiny eye movements to show you. Simple science-backed tricks you can do anywhere that actually improve eye health. My name is Dr. E.I. Williams. As a board-certified physician, I've seen what happens when we rely only on medication to manage eye health. But now, we have powerful evidence that specific daily movements, yes, physical activity, can directly protect your retina, optic nerve, and visual cortex of the eyes. In this video, I'll walk you through the daily movements and habits that can protect your vision naturally, reduce the risk of blindness, and keep your eyes younger for longer. Let's start with what we're up against. By age 60, 1 in 3 people will have some form of vision impairment. Diabetic retinopathy affects over 7 million Americans, and that number is rising. What's the connection? As we age, eyesight declines for many reasons. The lens stiffens, the retina weakens, blood vessels become fragile, and oxidative stress damages cells. The culprits? Poor circulation, chronic inflammation, sedentary lifestyle. Your eyes aren't just seeing organs, they're vascular powerhouses, and they rely heavily on blood flow, oxygen, and nutrient delivery. Without movement, these vital systems slow down. But research shows that up to 80% of vision loss can be slowed or prevented. And here's where it gets interesting. A 2024 study published in Investigative Ophthalmology and Visual Science showed that moderate aerobic exercise, just 30 minutes a day, increased retinal blood flow by up to 20% in seniors. Why is that a big deal? Because your retina is one of the most metabolically active tissues in your body. It needs constant oxygen, constant fuel. Blood flow is life or death for your vision. Lack of movement leads to microvascular decline. That's what causes capillary dropout in diabetic retinopathy. That's what damages your optic nerve in glaucoma. Exercise counters this. Why? Movement improves circulation to the retina and optic nerve. In fact, brisk walking 30 minutes a day can cut your risk of vision diseases in half. And we're not talking about marathons here. We're talking simple, low-impact, daily movements. While we are still on moving your body, let me tell you about the 30-minute rule. Research shows that walking just 30 minutes a day at a moderate pace can reduce the risk of glaucoma progression by up to 25%. Why? Walking boosts nitric oxide, improving blood vessel dilation in the eyes. It also reduces intraocular pressure, a major factor in glaucoma. Another walking tip that is worth discussing is gentle yoga. The science is clear. Slow, deliberate movement with controlled breathing can significantly reduce intraocular pressure. But here is a word of caution. Avoid head-down poses like downward dog if you have glaucoma. This next movement is extremely powerful, especially for diabetics. Here's why. Resistance training improves insulin sensitivity. Better insulin control lowers blood sugar and reduces risk of retinal damage. One study from JAMA Ophthalmology found that diabetic adults who practiced strength training twice a week had significantly slower progression of retinopathy. Now let's move on to another form of movement that is hardly talked about, micro movements for the eyes. Here are daily micro movements and habits that science says can recharge your eyes. First, the 20-20-20 rule. Every 20 minutes, look 20 feet away for 20 seconds. Second, blink more often. Screen time reduces blinking, drying your eyes. However, blinking lubricates the eyes and reduces tension in your eye muscles. Third, eye tracking movements. Tracing the infinity sign with your eyes strengthens the eye's muscles, stimulates circulation in and around the eyes. It also reduces dryness, stiffness, and tension from prolonged staring. Fourth, neck rolls and shoulder shrugs. These reduce tension in the muscles feeding ocular blood flow. Fifth, palming, hands gently covering eyes. This action increases blood flow around the eyes due to warmth from your palms. It reduces strain by relaxing the eye's muscles. Sixth, focus shifts, thumb near, object far. This exercise involves holding your thumb about 10 inches from your face, focusing on it, then shifting your gaze to an object farther away and back again. Your action here enhances blood circulation in the eyes by alternating near and far focus. Secondly, it trains the ciliary muscles, which control the eye's ability to switch focus, enhancing accommodation. Think of these activities as toothbrushes for your eyes. Now let's take a closer look at how eye movement training improves quality of life in people with age-related macular degeneration, also called AMD. Step 1. The challenge. This is what AMD looks like inside the eye. Notice those yellowish spots on the retina, called drusen. They distort central vision, making it harder to read, recognize faces, or follow text smoothly. Step 2. The training. Through guided eye movement exercises, like shifting your gaze up and down, left and right, or tracing an infinity symbol, the brain learns to use healthier parts of the retina. This retrains the eyes to work more efficiently, improving focus and improving flow. Step 3. The outcome. Patients often report being able to read faster, enjoy hobbies again, and reconnect with loved ones. Or whether it's using a computer, writing or simply watching television, the improvement in daily function directly boosts quality of life. And this is just one example of how micro movements aren't just about comfort, they're about regaining independence and joy after 60. In general, these movements benefit everyone, but especially those over 60, diabetics, people with high blood pressure, and anyone battling chronic disease. Improvements can be seen in just weeks. Now, daily movement isn't just exercise, it's lifestyle. Guess what? Move your diet by taking omega-3s and leafy greens to protect the eyes. Move your sunlight exposure, as 15 minutes of morning light regulates rhythms. Move your stress by practicing deep breathing, yoga, tai chi, and move your sleep, as deep, restful sleep repairs your retina. Okay, let's bust some myths. Wearing glasses doesn't weaken your eyes. Carrots alone won't save your vision. And no, it's not inevitable that eyesight fades with age. Science shows that daily movements change everything. Every step you take, every blink you make, every simple movement, it's preserving your window to the world. Starting today, choose one movement and do it daily. Over time, your eyes will feel younger, sharper, and stronger. Your eyes have carried you through decades of memories. Don't let them fade quietly. Let movement be your medicine, because the best days of your vision might still be ahead. Now, don't forget to subscribe for weekly, science-backed health insights. And hit the bell icon so YouTube reminds you every time I release new content. This is Dr. E.I. Williams, reminding you, it's not about adding years to your life, but adding vision to those years. Thanks for watching.